Hi, I'm Amanda. I'm going to be your nurse for today. Can I have you verify your name and date of birth?
Antonio Sager, July 16, 2002.
Okay, everything matches. I'm going to go wash my hands real quick, and then we'll come back for your assessment. Okay, I'm back from properly washing my hands, and I have my gloves on. Can you state if you have any allergies or on any medications?
No.
So no allergies to food, environment, or medications?
No.
And are you on any current medications?
No.
Okay, sweet. Okay, almost immediately you can identify that the patient is in no acute distress. They are sitting upright with a good posture. I'm going to be assessing the patient's orientation. Can you please tell me where you are, what we're doing, and roughly what time it is?
I'm at home. You're listening for my lungs, and it's 7 o'clock p.m.
And patient's orientation is regular. They seem to know what they're doing, where they are, and what time. To have the patient remove his clothing and put on dressing in private, so that way I will step out and come back so I can inspect his chest. Now I'm going to be inspecting the patient's chest, ribs, and spine for tenderness or any abnormal findings. You can see that everything is symmetrical. There is no bruises, lesions, or any visible signs of discomfort or distress. Now we're going to inspect the patient's chest for any signs of Barrett's chest, which can indicate COPD. See that the ratio is 1 to 2, anterior, posterior, indicating regular grading. Now I'm going to be palpating the patient's chest, ribs, and back for any tenderness. There's no tenderness. Edema is regular, as it would be classified as 1+, and there are no signs of discomfort. Now I will be inspecting and palpating the patient's neck for any unsymmetry in the trachea. So everything seems symmetrical, as there are no signs of tracheal deviation. I will auscultate the patient's lungs and make sure that there are no crackles, rickets, or any abnormal sounds or findings. Can I have you take a deep breath, please? Deep breath, please. Deep breath. 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 And deep breath. After assessing the patient's anterior view of their lungs, there are no swooshing, rickets, or crackles, indicating that everything is regular. Now we will turn to the posterior view of the patient and just assess that everything is also symmetrical on the other end. Now the patient has turned posteriorly, in which we can auscultate the patient lung sounds. Deep breath, please. Deep breath. 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 and deep breath. After assessing the patient from C7 to T10, in between their intercostals, you can identify that the patient's breathing is regular. There are no signs of discomfort. There are no crickets, whooshing, or any abnormal findings. Now we will test the patient for any signs of egophony and bronchophony, indicating that the lungs are filled with air instead of fluid. Can I have you say the phrase 99, please?
99.
And can I have you say the phrase E?
E.
Thank you. The patient's voices is normal and clear, and they seem coherent and able to easily be responded to. Now we will test the patient for whispered peculiarity, which will indicate if there are any lung consolidation. By doing so, I will ask the patient to state the phrase 1, 2, 3. Can you please state 1, 2, 3?
1, 2, 3.
Everything is clear and coherent, and everything is able to be understood. Lastly, I will be assessing the patient's chest expansion, and by doing so, I will look at the outward and anterior expansion to make sure that when the patient breathes in and breathes out, both the sides of my hands will be moving at the same time, and everything will be indicated as symmetrical. I'm just going to put my hands around your waist. Can I have you breathe in and breathe out, please? And breathe in and breathe out, please. You can see that the chest expansion is regular as both my hands moved up and down at the same time, and there indicates of symmetrical. Okay, do you have any questions or concerns for me today about your health or anything in general?
No.
Okay, thank you so much for your time. I'll see you next year for your yearly checkup.